Hi, it's Brittany from CaloSpa in Louisville, Kentucky. I know we've talked a lot about some of the treatments that we offer for non-invasive permanent fat reduction and skin tightening, but today we're going to bust a few of those myths out there that gives us a little bit of the wrong idea actually in regards to some of these amazing treatments. So let's start with number one. The first myth is that these treatments don't work. I disagree 100%. These treatments are wonderful. Determining the treatment for the patient is going to be based upon their needs, of course. And what we go over with patients during their consultation is, the things that we want them to do to help them achieve the best results, which is basically just maintaining a healthy lifestyle, not gaining weight. Things like that are going to contribute to your results as opposed to halt them. We stop producing fat cells in our adolescence, so what we have grow and shrink. The treatments that we use to permanently destroy these fat cells actually trigger something called apoptosis. So that's a natural fat cell death cycle that occurs over a 3-month period in the body. So these treatments do work, just as long as patients aren't gaining weight. Myth number 2. They moved my fat. I didn't move your fat. We can't move your fat. They can move your fat in the OR, but we can't move your fat with the non-invasive treatments. So as I was saying, how we have our fat cells right, that we stop producing them in our adolescence. What we have is what we have. It grows and it shrinks. So once we eliminate those cells, they're gone permanently. We eliminate them naturally through the lymphatic system, and they don't come back. We have not depleted all of those fat cells. So there are still cells remaining. What does that mean? That means if you gain weight, then you're more likely to notice it somewhere where we haven't treated. So we didn't move your fat, but again, most people who invest in the treatments, they don't gain weight. And they're excited, they get great results, they do work. There is a chance for somebody to be a non-responder to one of the treatments, but again, that's one of the benefits of being here at our facility, because we have something for everybody, and we have other treatments and modalities that we can use to try something if somebody does happen to be a non-responder, which those are very few and far in between. So, but again, non-surgical treatments, they take longer. Surgeries, one and done, instant results, beautiful results. Non-invasive, it just takes a little bit longer. So they do work. We don't move your fat. But let's see what we've got for myth number 3. Myth number 3, they can get rid of my cellulite. So nothing will permanently get rid of cellulite, just like nothing will permanently tighten skin, right? We can't stop the aging process, and believe it or not, cellulite is part of that. So it's definitely genetic. It's something that you can get, but from your mother perhaps. But it's also a combination of things. Again, I talked about how our connective tissue, our fascia, goes straight up and down, right? So as we age, our fat cells enlarge and they start to build, accumulate up in those chambers, and then our lymphatic drainage slows down, our blood flow slows down, we start to lose elasticity in our skin. Again, that aging process, that whole thing kind of starts to take place in our late 20s, early 30s, and so on, and it just speeds up. We can definitely improve the appearance of cellulite, and then patients can come back and they can do maintenance treatments as needed, and that's to their discretion. But again, there's definitely things that you can do lifestyle-wise to maintain your results. So, and we also have some fun stuff here that you can do to maintain or even enhance your results as well, such as our Skin Aid targeted solutions, the Cellullite formula. That's not necessarily true, but what is true is that we are genetically just made differently. Women will, through a lifespan, have a 10%, at least 10% higher amount of fat than men do on average. So it's not that men respond better, it's just that they have a little bit of a head start. Totally false. Tanning is going to speed the aging process. It's going to make it worse in the grand scheme of things over a period of time, and in the long run, it might look good for a few days having some bronze legs, but at the end of the day, you're doing more harm than you are good. So we definitely don't want you to do that. Again, those UVA, those UVB rays, they are really They're damaging your skin. They're gonna make the elasticity, the skin laxity, everything just much worse, which again is gonna really just cause havoc to the skin irregularities that are already possibly concerning somebody. So we definitely don't recommend the tanning bed. No, it makes you feel good, but just remember, you're really gonna be wishing you had it down the road. So no tanning bed. So I think that's all of the myths. I think it's at least a few that we've gotten to kind of conquer here now. But again, you know, complimentary consultations are so beneficial because not only can you ask those questions that you hear about things not working or men responding better, but we can also kind of talk to you about like why people might say some of those things. It could be maybe they had one treatment and not the two that was recommended because of the protocol. So there's a whole variety of things that probably come into the playing field when people maybe kind of talk down on some of these treatments, because over the course of 13 years, I've seen them come a long way. So they are magnificent, they are wonderful, they've made people feel so much better about themselves. So before you listen to what you hear, definitely come out and make sure you get all the facts.